Did you know that the medication you've been taking with peace of mind for years could be increasing your risk of a heart attack? Every day, millions of people use common medications without realizing they might be silently harming their hearts. In this video, we'll uncover the hidden dangers of 7 common medications that could elevate your risk of a heart attack. By understanding these risks, you'll be better equipped to discuss your health with your doctor and make informed decisions. We'll delve into how these drugs impact your heart, review the latest research findings, and offer practical tips to help you stay safe. But that's not all. Stick around until the end, and we'll reveal 3 additional medications with similar risks to your cardiovascular health. Don't forget to like this video and subscribe to our channel for the latest updates on heart health. Hit the bell icon to stay informed. Let's get started. Starting our list with number 1, painkillers. Painkillers, specifically opioids, are widely used for their effective pain-relieving properties but pose significant cardiovascular risks. Opioids, such as morphine, oxycodone, and fentanyl, are powerful medications prescribed for severe pain, often following surgery or injury. These drugs work by binding to opioid receptors in the brain and spinal cord, altering the perception of pain and providing relief. However, their benefits come with serious side effects, particularly concerning cardiovascular health. Opioids have been shown to depress the central nervous system, which can adversely affect heart function. One of the major concerns is their impact on heart rhythm. Opioids can lead to bradycardia, slow heart rate, and hypotension, low blood pressure, both of which can increase the risk of heart attacks. Furthermore, opioid use often leads to physical dependence and tolerance, meaning that over time, patients may require higher doses to achieve the same level of pain relief. This escalation can exacerbate cardiovascular risks, as higher doses are associated with a greater likelihood of adverse effects on the heart. Historical data from the opioid crisis highlights these dangers vividly. During the height of the crisis, many individuals who relied on opioids for chronic pain experienced unexpected cardiovascular events, including heart attacks. Studies have shown that long-term opioid users are at a higher risk for heart-related complications, partly due to the cumulative effects of increased doses and the drug's impact on heart function. For individuals relying on opioids, it is crucial to discuss alternative pain management strategies with healthcare providers. Non-opioid pain relief methods, such as physical therapy, acupuncture, or non-opioid medications like acetaminophen and NSAIDs, can help manage pain without the same level of cardiovascular risk. Regular heart health monitoring is also advisable to catch any early signs of cardiovascular issues and address them promptly. Moving to number 2, antibiotics. Antibiotics, particularly fluoroquinolones, are potent drugs used to treat a variety of bacterial infections. However, these medications come with significant cardiovascular risks. Fluoroquinolones, such as ciprofloxacin, levofloxacin, and moxifloxacin, are valued for their broad-spectrum antibacterial activity and are often prescribed for severe infections when other antibiotics may not be effective. They work by inhibiting bacterial DNA gyrase and topoisomerase IV, enzymes essential for bacterial DNA replication and repair. Despite their efficacy in combating infections, fluoroquinolones have been associated with serious side effects, particularly affecting heart health. One of the primary concerns with fluoroquinolones is their potential to cause severe arrhythmias, which are abnormal heart rhythms that can lead to sudden cardiac events. These medications can disrupt the electrical activity of the heart, leading to conditions such as QT interval prolongation. The QT interval is a measure of the time it takes for the heart's electrical system to reset between beats, and prolongation of this interval can increase the risk of life-threatening arrhythmias like torsades de pointes, a type of ventricular tachycardia. Research published in the Journal of the American College of Cardiology highlights that fluoroquinolones are associated with a notable increase in the risk of such arrhythmias. The study demonstrated that patients taking these antibiotics had a higher incidence of abnormal heart rhythms compared to those taking other types of antibiotics. The cardiovascular risks posed by fluoroquinolones are particularly concerning for individuals with pre-existing heart conditions, such as coronary artery disease or congestive heart failure, and those with other risk factors for cardiovascular issues. For these patients, the use of fluoroquinolones requires careful consideration. It is crucial to weigh the benefits of treating a bacterial infection against the potential cardiovascular risks. In such cases, healthcare providers might opt for alternative antibiotics that have a safer cardiovascular profile. Additionally, monitoring heart function during treatment with fluoroquinolones is essential to detect any adverse effects early. Regular electrocardiograms, ECGs, and close observation for any symptoms of arrhythmias can help manage and mitigate these risks. In summary, while fluoroquinolones are effective in treating serious infections, their potential to cause severe cardiovascular issues necessitates cautious use and vigilant monitoring, especially in patients with underlying heart conditions. Next, at number 3, diabetes medications. Diabetes medications, such as thiazolidinediones and dipeptidyl peptidase 4, DPP4, inhibitors, are widely used to manage blood sugar levels in individuals with diabetes. While these medications play a crucial role in glucose control, they also come with notable cardiovascular risks that require careful consideration. Thiazolidinediones, including rosiglitazone and pioglitazone, are effective in enhancing insulin sensitivity and lowering blood glucose levels. They work by activating peroxisome proliferator activated receptor gamma, PPAR gamma, which improves insulin sensitivity in muscle and fat tissues. However, these drugs are associated with significant cardiovascular risks, particularly heart failure. Thiazolidinediones can cause fluid retention, leading to increased blood volume and heightened pressure on the heart. This fluid retention often results in or worsens existing heart failure, especially in patients who are already predisposed to cardiovascular conditions. Research has demonstrated a clear association between thiazolidinedione use and adverse cardiovascular outcomes. For instance, long-term studies have shown that rosiglitazone is linked to an increased risk of heart attack and stroke, while pioglitazone has been associated with an elevated risk of heart failure. The risk of heart failure with thiazolidinediones is particularly pronounced, making it crucial for patients on these medications to be closely monitored. Dipeptidyl peptidase 4, DPP4, inhibitors, such as sitagliptin and saxagliptin, are another class of diabetes medications that have a generally lower profile for cardiovascular side effects compared to thiazolidinediones. These drugs work by inhibiting the DPP4 enzyme, which increases levels of incretin hormones that help regulate insulin and glucose levels. Although DPP4 inhibitors are considered safer in terms of cardiovascular risk, there is evidence suggesting they may still pose risks, especially in patients with pre-existing heart conditions. Some studies have indicated that certain DPP4 inhibitors can be associated with an increased risk of heart failure or other cardiovascular issues. For example, saxagliptin has been linked to a higher risk of hospitalization for heart failure in some clinical trials. For individuals on these diabetes medications, it is essential to engage in regular cardiovascular monitoring. This includes periodic evaluations of heart function and adjusting the medication regimen as needed. Alongside medication management, lifestyle modifications such as adopting a heart-healthy diet, engaging in regular physical activity, and managing other cardiovascular risk factors are critical. By integrating these strategies, patients can better manage both their diabetes and cardiovascular health, thereby reducing the overall risk of adverse outcomes. Moving to number 4, hormone replacement therapy. Hormone replacement therapy, HRT, is commonly prescribed to manage menopausal symptoms such as hot flashes, night sweats, and mood swings. While HRT can significantly improve the quality of life for many women by alleviating these symptoms, it is associated with potential cardiovascular risks that warrant careful consideration. HRT typically involves the administration of estrogen, and in some cases, progesterone, to compensate for the decline in hormone levels that occurs during menopause. The primary aim of HRT is to replace these hormones to ease menopausal symptoms and improve overall well-being. However, the cardiovascular implications of HRT have been a subject of extensive research, with studies revealing a complex risk profile. One of the major concerns with HRT is its potential to increase the risk of heart attacks and blood clots. Research, notably from the Women's Health Initiative, WHI, has highlighted that combined estrogen and progesterone therapy can elevate the risk of cardiovascular events. The WHI study found that women using combined HRT had a higher incidence of coronary heart disease, stroke, and venous thromboembolism compared to those not on hormone therapy. The increased risk is thought to be related to the therapy's effects on blood clotting mechanisms and changes in blood vessel function. Estrogen can affect clotting factors in the blood, increasing the likelihood of blood clots, which in turn raises the risk of heart attacks and strokes. The cardiovascular risks associated with HRT can vary based on several factors. Women who start HRT closer to the onset of menopause and those without pre-existing heart conditions might experience a different risk profile compared to those who begin therapy later in life or have existing cardiovascular issues. The duration of therapy also plays a role. Longer use may exacerbate the risks. Given these considerations, it is crucial for women to engage in thorough discussions with their healthcare providers to weigh the benefits of symptom relief against the potential cardiovascular risks. Healthcare providers often assess individual risk factors, including age, family history of heart disease, and personal health history, to determine the most appropriate approach to managing menopause symptoms. For some women, alternative treatments or non-hormonal options may be recommended to mitigate cardiovascular risks while addressing menopausal symptoms. Regular monitoring and personalized treatment plans are essential to ensure that the approach to managing menopause is both effective and safe for cardiovascular health. Continuing with number 5, weight loss drugs. Weight loss drugs, especially those that are amphetamine-based, present quick solutions for weight management but come with significant cardiovascular risks. These medications, including phentermine and diethylpropion, are designed to suppress appetite and increase metabolic rate, offering an effective means to reduce body weight. They achieve this by stimulating the central nervous system, which can enhance feelings of fullness and boost energy expenditure. However, the stimulant effects inherent in these drugs can have a profound impact on heart health. Amphetamine-based appetite suppressants can lead to elevated heart rate and increased blood pressure, which are major contributors to an increased risk of cardiovascular events. These drugs stimulate the release of norepinephrine, a neurotransmitter that can elevate heart rate and blood pressure by constricting blood vessels. The resulting increase in cardiac workload and blood pressure can precipitate arrhythmias, which are abnormal heart rhythms that may lead to severe complications such as heart attacks and strokes. This is particularly concerning for individuals with pre-existing heart conditions or those who are already at a higher risk for cardiovascular disease. Long-term use or high doses of amphetamine-based weight loss medications have been associated with a range of adverse cardiovascular events. Studies have consistently shown that the risks associated with these drugs often outweigh their benefits. For example, a comprehensive review published in the American Journal of Cardiology indicated a significant increase in the risk of heart attack and stroke among users of stimulant-based weight loss drugs. The review highlighted that while these medications might provide short-term weight loss, the long-term cardiovascular risks make them a less viable option for sustained weight management. Given these risks, individuals seeking to manage their weight are generally advised to consider non-pharmaceutical approaches. Strategies such as adopting a balanced diet, engaging in regular physical activity, and making lifestyle changes are not only safer but also more sustainable. These methods promote healthy weight loss without the added cardiovascular risks associated with stimulant-based medications. Incorporating these lifestyle changes can lead to long-term weight management benefits and overall improved heart health, reducing the need for potentially hazardous pharmaceutical interventions. Moving to number 6, some stimulant medications. Stimulant medications, frequently prescribed for conditions like attention deficit hyperactivity disorder, ADHD, present notable cardiovascular risks despite their effectiveness in improving focus and attention. Common stimulants, such as amphetamine salts, e.g., Adderall, and methylphenidate, e.g., Ritalin, operate by increasing levels of neurotransmitters such as dopamine and norepinephrine in the brain. This neurotransmitter enhancement helps alleviate symptoms of ADHD, enhancing cognitive function and attention span. However, these stimulants can also significantly impact the cardiovascular system, posing potential risks. The primary cardiovascular concerns associated with stimulant medications involve their effects on heart rate and blood pressure. Stimulants stimulate the central nervous system, leading to increased release of norepinephrine, a neurotransmitter that can constrict blood vessels and elevate heart rate. This heightened cardiovascular activity can result in increased blood pressure and heart rate, both of which are risk factors for cardiovascular events such as heart attacks and strokes. For individuals with pre-existing heart conditions, such as hypertension or arrhythmias, these stimulant-induced changes can exacerbate their existing conditions or contribute to the development of new cardiovascular issues. Research underscores the cardiovascular risks associated with long-term stimulant use. Several studies have indicated a correlation between stimulant medications and an increased incidence of cardiovascular complications. For example, a study published in the New England Journal of Medicine found that long-term use of stimulants in ADHD patients was linked to an elevated risk of myocardial infarction and stroke. These findings highlight the need for careful cardiovascular assessment before initiating stimulant therapy and ongoing monitoring throughout treatment. Healthcare providers must thoroughly evaluate patients' cardiovascular health before prescribing stimulant medications and remain vigilant for any adverse cardiovascular effects during treatment. For patients using stimulants, incorporating lifestyle modifications, such as a balanced diet, regular physical activity, and effective stress management, can help mitigate some of the cardiovascular risks. In certain cases, healthcare providers might consider alternative treatments with a lower cardiovascular risk profile or adjust medication dosages to better balance therapeutic benefits with cardiovascular safety. By addressing these risks proactively, patients can manage ADHD symptoms while minimizing potential impacts on their heart health. Next, at number 7, oral contraceptives. Oral contraceptives are widely used for birth control and managing menstrual symptoms, offering an effective means to regulate reproductive hormones and prevent pregnancy. These medications typically contain synthetic forms of estrogen and/or progesterone, which work to suppress ovulation and stabilize menstrual cycles. However, despite their benefits, oral contraceptives can carry cardiovascular risks that warrant careful consideration. One of the most significant cardiovascular risks associated with oral contraceptives is the increased likelihood of blood clots. The synthetic estrogen in these medications can elevate the levels of clotting factors in the blood, thereby increasing the risk of thrombotic events. This heightened risk can lead to conditions such as deep vein thrombosis, DVT, where blood clots form in the deep veins of the legs, or pulmonary embolism, where a clot travels to the lungs and obstructs blood flow. Additionally, there is an increased risk of stroke, particularly for women with pre-existing risk factors or those who engage in behaviors that exacerbate cardiovascular risk. The cardiovascular risks associated with oral contraceptives are influenced by several factors. For example, women who smoke, are over the age of 35, or have a history of cardiovascular disease are at a higher risk of experiencing adverse effects from these medications. Research, including studies published in journals such as the British Medical Journal, has demonstrated that while the overall risk of heart attack and stroke is relatively low for most women using oral contraceptives, it remains a notable concern for those with additional risk factors. For women considering oral contraceptives, it is crucial to engage in a thorough discussion with their healthcare provider about their cardiovascular health. A healthcare provider can assess individual risk factors and determine whether the benefits of using oral contraceptives outweigh the potential risks. Women with significant risk factors may need to explore alternative contraceptive methods or undergo more rigorous monitoring if they choose to use oral contraceptives. By taking a personalized approach to contraception, women can manage their reproductive health while mitigating cardiovascular risks effectively. Moving to number 8, antidepressants. Antidepressants, particularly selective serotonin reuptake inhibitors, SSRIs, are widely prescribed to treat depression, anxiety, and other mental health disorders. SSRIs, including commonly used medications such as fluoxetine, sertraline, and escitalopram, are celebrated for their efficacy in enhancing mood and alleviating symptoms of various mental health conditions. However, despite their benefits, SSRIs can present certain cardiovascular risks that need to be carefully managed. SSRIs function by increasing the levels of serotonin in the brain, which helps regulate mood and emotional states. However, these medications can also affect cardiovascular health in several notable ways. One significant concern is their impact on blood pressure regulation. SSRIs can sometimes cause orthostatic hypotension, a condition where blood pressure drops significantly upon standing, leading to dizziness, fainting, or falls. This drop in blood pressure can exacerbate cardiovascular problems, particularly in individuals with existing heart conditions. Moreover, SSRIs have been associated with QT interval prolongation, a disruption in the heart's electrical cycle that can lead to severe arrhythmias. The QT interval is a measure of the time it takes for the heart's electrical system to reset after each heartbeat. Prolongation of this interval can result in potentially dangerous heart rhythm disturbances, such as torsades de pointes, which may lead to sudden cardiac events. Studies have highlighted that while the overall risk of these complications is relatively low, it is still a concern, especially for individuals with pre-existing cardiovascular issues. The cardiovascular risks associated with SSRIs are generally considered lower compared to other medications on the list, but they are not negligible. For individuals with a history of heart disease or those at higher risk for cardiovascular issues, it is essential to monitor heart health closely while on SSRIs. Regular consultations with a healthcare provider can help balance the benefits of antidepressant therapy with the potential cardiovascular risks. In some cases, alternative treatments or lifestyle modifications, such as a heart-healthy diet and regular exercise, may be recommended to mitigate these risks. By maintaining an open dialogue with healthcare providers and carefully managing treatment plans, individuals can achieve better mental health while minimizing potential cardiovascular concerns. Moving to number 9, asthma medications. Asthma medications, particularly long-acting beta agonists, LABAs, play a crucial role in managing chronic asthma by providing extended relief from symptoms. LABAs, such as salmeterol and formoterol, are designed to relax and open the airways, making breathing easier for individuals with asthma. These medications are typically used in combination with inhaled corticosteroids to maintain long-term asthma control. However, while LABAs are effective for improving respiratory function, they also carry potential cardiovascular risks that need to be carefully managed. LABAs exert their effects by stimulating beta-adrenergic receptors in the bronchial muscles, leading to bronchodilation and improved airflow. Despite these benefits, the stimulation of these receptors can also influence heart function. One of the primary concerns is the potential for LABAs to cause heart rate disturbances. The activation of beta-adrenergic receptors is not confined to the lungs. It also affects the cardiovascular system, where it can lead to palpitations and irregular heart rhythms, known as arrhythmias. The impact on heart rate and rhythm can be particularly concerning for individuals with pre-existing cardiovascular conditions or those at an increased risk of heart disease. Research has shown that LABAs can cause or exacerbate cardiovascular issues, such as increased heart rate and elevated blood pressure. For instance, studies have found that long-term use of LABAs can be associated with an increased risk of arrhythmias, which can potentially lead to more severe cardiovascular events. This risk is heightened in patients with underlying heart conditions or those who use high doses of LABAs. To balance the effective management of asthma symptoms with cardiovascular health, it is important for asthma patients to use LABAs under the guidance of a healthcare provider. Combining LABAs with inhaled corticosteroids can help mitigate some of the cardiovascular risks associated with these medications. Regular monitoring and consultations with healthcare providers are essential to ensure that any potential cardiovascular issues are identified and managed promptly. Patients should also be vigilant for any unusual symptoms, such as palpitations or chest pain, and report them to their healthcare provider immediately. By taking a comprehensive approach to asthma management that includes both effective treatment and cardiovascular monitoring, patients can maintain better overall health while minimizing the risks associated with LABAs. Continuing with number 10, decongestants. Decongestants, commonly included in over-the-counter cold and allergy medications, are widely used to alleviate nasal congestion. These medications, which often contain active ingredients like pseudoephedrine or phenylephrine, work by constricting blood vessels in the nasal passages to reduce swelling and relieve congestion. While they can be effective in managing symptoms of colds and allergies, decongestants also pose significant cardiovascular risks that warrant careful consideration. The mechanism of action for decongestants involves vasoconstriction, or the narrowing of blood vessels, which helps to decrease nasal swelling and improve airflow. However, this vasoconstriction is not limited to the nasal passages. It can also impact blood vessels throughout the body. As a result, decongestants can lead to increased heart rate and elevated blood pressure. These stimulatory effects can have serious consequences for cardiovascular health, particularly in individuals with existing heart conditions or hypertension. Research has highlighted the cardiovascular risks associated with decongestants, noting that their use can exacerbate pre-existing hypertension or contribute to the development of new cardiovascular issues. For example, a study published in the Journal of Clinical Hypertension found that pseudoephedrine and phenylephrine can significantly raise blood pressure in susceptible individuals. This elevation in blood pressure increases the risk of heart attacks and strokes, making decongestants potentially dangerous for those with a history of cardiovascular disease or high blood pressure. Given these risks, it is crucial for individuals using decongestants to be mindful of their cardiovascular health. Consulting with a healthcare provider before using these medications is especially important for those with pre-existing heart conditions or hypertension. Healthcare providers can offer guidance on safer alternatives, such as saline nasal sprays or steam inhalation, which can provide symptom relief without the same level of cardiovascular risk. These non-stimulant options help to alleviate nasal congestion without affecting blood pressure or heart rate, offering a safer approach to managing cold and allergy symptoms. In summary, while decongestants can be effective for reducing nasal congestion, their impact on cardiovascular health cannot be ignored. The potential for increased heart rate and blood pressure makes it essential for users, especially those with underlying cardiovascular conditions, to seek medical advice and consider alternative treatments. By taking a proactive approach to managing symptoms and cardiovascular health, individuals can make safer choices and minimize their risk of adverse cardiovascular events. If you have a history of heart disease, your doctor may suggest alternative antibiotics that have a safer cardiovascular profile. Regular monitoring of your heart function during antibiotic treatment is also crucial to detect and address any potential issues early. So there you have it. 10 common medications that might increase your risk of a heart attack, ranging from prescription painkillers to certain antibiotics. Understanding these risks is vital for making safer health choices. Opt for alternatives where possible and keep up with regular checkups to monitor your heart health. Being proactive can greatly reduce your risk of adverse cardiovascular effects from these medications. Which medication surprised you the most? Do you have any tips for managing heart health while on medication? Share your thoughts in the comments below. If you found this video helpful, please like it, subscribe to our channel for more heart health content. Thank you for watching, and remember, staying informed is key to maintaining a healthier, stronger heart.